Good afternoon, and welcome to Session 3B, Compassion, Fatigue, and Resilience. My name is Janelle Roper, and I am the Patient Care Director at Virginia Hospital Center, and I will be hosting today's panel. As a reminder, everyone is muted. The last 10 minutes of today's session will be used to answer questions, so please enter your questions in the Q&A box at any time during the session. Feel free to chat with one another in the chat box. Let's get started with a brief introduction of our presenter. Melissa Garcia is the Director of Operations at Dominion Hospital, a part of the HCA Health System. She is also the Vice Chair of the VHHA Behavioral Health Committee. Melissa was appointed the Director of Operations of Dominion Hospital in July of 2019. Prior to the role, Melissa held the position of Director of Social Work at Dominion Hospital and has been with HCA Healthcare since February of 2015. Before joining Dominion Hospital, Melissa worked in behavioral health facilities in both the public and private sector in Pennsylvania and Virginia, including the Northern Virginia Mental Health Institute and Arlington Community Service Board. Melissa earned her Master of Social Work degree from the University of Pittsburgh in Pittsburgh, Pennsylvania. Master of Business Administration and Healthcare Administration from Champaign College in Burlington, Vermont. At this time, I would like to turn the session over to Ms. Garcia.
Thank you so much, Janelle, for that opening. We'll go ahead. I'm going to share my screen. Thank you, everyone.
Please put it in the slide share from the beginning. Click on that. Perfect.
Okay, great. All right, thank you so much for attending my session today on compassion, fatigue, and resilience, helping the helpers. And thank you for that warm introduction, Janelle. Today in our session, we're going to be looking at recognizing signs and symptoms of stress and compassion fatigue. We're also going to look at defining and describing the phases of compassion fatigue. Today, we're also going to review 2 assessment tools to understand personnel levels of compassion satisfaction and compassion fatigue. And we're going to finish with identifying strategies to cultivate hope, compassion, and resilience in our workforce. And before we go ahead with this presentation, I have a 2-minute video that we're going to be sharing today.
Whoa, that's not good.
Oh, I don't need this. I'm already late.
Somebody will come. Anybody out there?
Do you have a phone?
No. Sorry. Somebody! Hello? There are 2 people stuck on an escalator and we need help. Now, would somebody please do something?
Help! Help! Help!
I don't believe this. You gotta be kidding me.
I'm gonna cry.
Well, there's not enough left to do, is there?
Hello? Hey, don't worry about it. I'll fix it in a second.
He said he could fix it. All right. All right. That's more like it. He says he can fix it.
Walking down the sidewalk, kicking my feet as I'm moving to the music. Step to the beat. I woke up today, canceled all my plans, and I stepped right outside with my guitar in my hands, and the notes became loud as the sound caressed the air, and I kicked it up a notch as I strolled without care, 'cause I'm going down the road to a brand new place.
All right, we're going to go back to the PowerPoint. So have you ever felt stuck like that? When I talk with some of our colleagues and across the Commonwealth of Virginia, I often get that, at times, we feel stuck and we don't know a way to get out when we have compassion fatigue. So today we're going to highlight some of those components and wanted to share that video with you. All right, looking at this screen, I want to talk about one of my favorite quotes, and that's taking care of myself doesn't mean me first, it means me too. And that's going to be part of the theme that we're going to be talking about during today's presentation. I also appreciate Fred Rogers' comments. When I was a boy and I would see scary things in the news, my mother would say to me, look for the helpers. You will always find people who are helping. And that's our audience today. And that's why we're putting together this presentation today, to focus on how we can help the individuals that are helping our community at large at all times. So we're going to talk a little bit about what the professional quality of life scale is. When we break down our professional quality of life as in our workforce, we look at compassion, satisfaction. Those are those positive aspects of helping others, those aspects that bring you joy. You're driving into work and you're excited about going into work. This also protects against compassion fatigue, maybe those higher workloads, or you're having a couple extra admissions come in, but that compassion satisfaction allows you to balance that stress. The other component of professional quality of life is compassion fatigue, and that's where we're going to be spending some of our time on. This is the negative aspects of helping others. And compassion fatigue is not a diagnosis, so we're not going to be talking about that from that lens today. When I think about compassion fatigue, there are antecedents of compassion fatigue. Those are those antecedents that we start thinking about that can lead to compassion fatigue if we don't address that. This could be nursing shortages. This could be shift work, your inability to recover between shifts. Maybe you're volunteering for extra shifts to get ready for the holidays, but you're not aware of the extended shifts that are paying a toll on your mental health. When we transition from antecedents of fatigue and going into the fatigue scale, this is where you're starting to feel subjective feelings of tiredness. This starts interfering with cognitive abilities. Your colleagues may be coming up to you saying, you know, can I have that report due? That report was due yesterday. And you're like, oh my gosh, I got to get to it. I got to do that. Because you have a sustained sense of exhaustion. And so your ability to prioritize diminishes. There is Francois Mathieu from her work at Queen's University calls this empathic strain. And so when you're starting to have that empathic strain and that fatigue sets in, we start then transitioning to what's called the consequences of fatigue. This is where the consequences of fatigue start impacting patient safety, your medication errors, poor decision-making, nurse satisfaction or nurse safety. You might have a disrupted circadian rhythm, and you might start talking about burnout. When we think of burnout, the negative outcomes of unaddressed compassion fatigue. And pre-COVID-19, we talked about burnout. A lot of people would just start talking and saying, oh, well, burnout's a thing, but you just got to get over it. And as we've seen the impact of COVID-19 on our healthcare colleagues across the Commonwealth, we've seen what burnout looks like, and we've been able to identify that and pay more attention to that with those we work with. Burnout has observable symptoms, and burnout is a diagnosable disorder. So the World Health Organization has upgraded its definition of burnout for 2022 edition of the International Classification of Diseases. It's calling it an occupational phenomenon that comes from chronic workplace stress that has not been successfully managed. And today we're going to talk a little bit about how to successfully manage that, because COVID-19 and the impact of the pandemic has also identified that not only is it a chronic workplace stress or an occupational phenomenon, but all of us have been wearing different hats, such as caregivers in the home and taking care of individuals or loved ones, where we might be having additional stressors that we're bringing to the workplace every day. So when do I get help? Like, when do I know that this has reached a threshold? And I appreciated this pictorial of stress first aid for firefighters and emergency services personnel, because it translates into our healthcare system. So when you're thriving, you're going into work saying, I got this. You're calm, you're steady, you're able to take things in stride. When you start transitioning to that surviving, something isn't right, this is where your colleagues might be coming to work saying, oh, I just couldn't sleep last night. I kept thinking about the cases from yesterday. Or you might have muscle tension, chronic headaches, inconsistent performance. not attending a meeting because you forgot that it was on the calendar. Where we see this escalating is struggling and in crisis, where we need to address this. And struggling is, I can't keep this up. Persistent fear, anxiety, exhaustion, poor performance, avoiding interactions with coworkers. You may have additional restless and disturbed sleep, and you might even begin to self-medicate with substances, food, or other numbing activities. And when you get into the in crisis mode, this is where immediate intervention is needed. Several of you on the lines are also helpers of helpers. So this is where you might be in a management or a leadership role where you're helping lead a team of individuals working in a healthcare setting. And so what can supervisors and managers do? In the healthy phase, you want to begin to foster those relationships with staff. You want to encourage communication. In all of our themes since this morning, we've talked about ways to normalize mental health. We've talked about the importance of taking care of our workforce and being a proactive problem solver. When an intervention is needed, you might begin to talk to your employee about taking some leave, going home early, helping them balance their personal and professional obligations. That's that employee that's coming and saying, I'm not sure I can do this. And you say, just leave, just go home, focus on your family, come back tomorrow, we'll come up with a game plan. And when individuals have maximized their ability and they just are not able to continue on with their workplace, this is where you want to be patient. You want to involve a EAP or a mental health resource and consult and involve other colleagues within your network. So one tool that I have used in clinical supervision with social work supervisees, in addition to the workforce in general in my emergency service experience, is called the Professional Quality of Life Scale. This is a tool for self-assessment of your professional quality of life, measuring compassion satisfaction and compassion fatigue within the last 30 days. What I appreciate about this, I want to give credit to the Center for Victims of Torture. So this is a free tool that we can utilize with two caveats. One, that we don't sell it, and two, that we give credit to the Center for Victims of Torture. And this is also going to be in a reference so that you can click on this at the end of the session and be able to tap into this resource. But this allows you to sit with a colleague and ask them to reflect on their professional quality of life within the last 30 days by answering these questions. It's a self-rating assessment that they can complete on their own. They can complete the self-assessment, and then you can ask them to say, where did they rate themselves? Did they rate themselves with compassion satisfaction? Did they identify that they are either approaching or within compassion fatigue? Or are they at the burnout stage where there needs to be an evaluation of either work-life balance, or a pause because it's starting to impact patient care? Another tool that can be utilized is the self-assessment tool for core competencies. It's a peer role of self-care. And I put on the screen a copy of the emotional self-care, where you can begin to have individuals do this self-dialogue, or you also on this presentation today can go ahead and complete this today to see where you're at with your emotional self-care. In addition, I also volunteer for the Give an Hour program, which is where licensed clinicians across the US can volunteer to provide pro bono mental health impact individual sessions or resource management to individuals within the military. And they had created this great sheet that says mental health providers can cope with anxiety from the pandemic. And what I appreciated about this was being able to take time to examine and reflect the lessons learned from the pandemic. At this time, I feel like it's important that we slow down now that we had our peaks and valleys of the pandemic, and looking at examining how are we doing, how's our role, are we happy in our current role, do we need a plan to build in additional self-care? Because as virtual platforms launch into in-persons, there was a lot of people liked being virtual. They liked the protective factors of not being on screen all the time, not having to participate in meetings. And so individuals going back to work, or individuals launching from virtual to in-person platforms, might be adjusting to that new norm, which might be creating an increase in stress as well. So after we've identified these assessments, the biggest things to think about are making space for joy without guilt. You want to also think about time management and how to have conversations with yourself, with your family, and others about asking for and accepting help. Some of the tools that I've been able to gather from several of you across our networks and our colleagues have been Headspace. This website provides helpful tips on meditation, sleep, and stress management. Some individuals have downloaded the Calm app. A couple nurses that I work with at Dominion also do the hashtag SelfCare app, and Sleep School, which is helps offer drug-free evidence for businesses to sleep better and become more productive. Where I've seen also an opportunity for us to consider helping this compassion fatigue and burnout is practicing resiliency and flexibility at home. A lot of us wear multiple hats. We're not just the colleague that works at our work. We're also parents, we're significant others, we're caretakers and other roles. That it's very important that we're eating well, exercise, sleeping well, and maintaining a positive work-life balance. And that's essential to personal well-being, because if we're not taking care of things at home, that can lead into our compassion fatigue at work. When I think of self-care plan ideas, what I appreciate about this PowerPoint is everything at blue you can kind of do at work. Everything in the, I would say, tan color for physical care. The darker tan would be emotional coping, and that yellow is whatever gives you joy. And if you haven't paused for a moment today throughout this summit, or within the last week, I would see if you've been able to identify what are your top 3 things that can give you joy. And if you're having a difficult time doing that, during the break, make sure you write those 3 things down and share them with your colleague or your family. Because when you have accountable partners and individuals that hold you accountable for those items that give you joy, it can help you stay on track and prioritize them into what you do every day. So some tips to improve resilience, we've talked about a lot, and it's hard to put compassion fatigue into a 20-minute presentation, but I wanted to talk a little bit more about tips to improve that resilience. The most important thing is build connections, prioritize your relationships. If needed, consider joining a support group, professional support groups that you can do book clubs for that focus on a little bit of getting out of your routine every day. Remain hopeful and accept change. Avoid those negative outlets. If you're at work and you have a cohort of individuals that are talking about what's not going well in the group, when you stay in those negative outlets and you don't have someone that can add a solution to it, that's different than venting. Venting is appropriate. Staying in a negative outlet isn't. Staying in that negative outlet fosters the track and can lead to compassion fatigue. And make every day meaningful. Some books for further growth that you can consider is Trauma Stewardship. This is an everyday guide to caring for yourself and caring for others. One of my favorite books is The Body Keeps the Score, Brain, Mind, and Body and the Healing of Trauma. And trauma means a lot of different things to different people, but I always say if your body's trying to tell you something's off balance. And if you don't want to identify it as trauma, you can just identify it as something that's impacting your life. Resilience, hard-won wisdom for living a better life, Man's Search for Meaning, and Writing to Heal. And I just want to take this time to say thank you so much for participating in this presentation today. I'm looking forward to the Q&As if anyone has any questions. And I also wanted to share that there's 2 favorite things that are on here of mine that bring me joy. One of them is coffee, and I had a shot of espresso before this presentation, so I might have talked a little faster during this presentation. And today I'm actually getting ready to board a plane here in the next 2 hours to run a marathon this Saturday in Fargo, North Dakota. And so thank you so much for participating, and I'm looking forward to the Q&A right now.
Melissa, thank you so very much for a very timely and enlightening presentation. Now I will share a few questions with you from our audience. After I complete the assessment, who should I speak to about the results?
Thank you, Janelle. That's a great question. After you complete the Pro QLL assessment, what I would recommend you do is talk to a colleague, or you can even share it with a colleague, or share it with your supervisor. And if you are a supervisor, you can use that time to reflect on that and talk about it with your supervisor, or bring it to a team meeting where you can then share it with your team about the importance of what this is looking like, and then what do I need to do to get on track. I would say for those that are completing it and you're not used to having those conversations with supervisors, that you plan it out. So you write out, what you've identified and what solutions you want to build in to that, so that you are prepared for that presentation piece.
Thank you. We have one more. The quality of life scale. Do you recommend administering it periodically to the staff to gauge where the team stands?
Absolutely. This is a great question. For social work supervisees, I usually use this twice a year. I do a check-in, or if I'm seeing signs and symptoms of compassion fatigue starting to settle in. So if someone's coming in for clinical supervision or for my employee rounding, and I'm seeing a disengagement that I haven't seen before, or I'm seeing an increase in things not being completed on time, that's where I'm usually going to say, I think it's time to do a check-in on to see how we're doing. And I want to see how best I can support you in this, and being able to navigate that with you.
Awesome, thank you. We have one more. Do you know any specific assessments about impact of COVID on healthcare personnel?
That's another great question. There's been some literature that I've been able to read and connect with the colleagues. I'm not seeing too many assessments coming out yet, but I believe that the assessments are going to be forthcoming. What I have seen was the impact of COVID-19 on introverts versus extroverts, and how that has impacted healthcare personnel. And so individuals that may have lean in more towards being an introvert actually thrived in a professional setting when they didn't have to be in meetings and presentations, and that they had that time to foster in. Now we're seeing some of that happen now that the presentations are too back to back, or your meetings are starting to become so progressive that that's not meeting that. So, I'd be interested in, if there was a subgroup of this group that would be interested in doing that and looking at that, maybe we could be leading the way in Virginia and coming up with that for, across the Commonwealth of Virginia. I'd be happy to be part of a subgroup that would look into that.
Okay, all right, we have one more. What are some real-time strategies that a unit manager can implement to help their staff members?
It's a great question. I would say, one of the things that, we've been doing at Dominion Hospital is having communication boards. And so making sure that as a unit manager of either your hospital or your unit, that your communication boards not only share the statistics of what's going on your unit, but that have motivational quotes, maybe a team building outing, looking at a book club, looking at different ways that employees who find joy outside of work can make connections. In Virginia, the NAMI walk is coming up. So if your team hasn't connected with the NAMI walk, getting out of the office and doing something that brings you joy and brings you back to the meaning of why you got into behavioral health in the first place.
Great, thank you so very much. Well, those are all of the questions that we have in the Q&A box. Thank you so much, Melissa. It was a pleasure having you, sharing your knowledge and expertise with us today. And thank you, audience members, for attending and your questions. Please join us at 2:25 for our closing keynote at 2:30 p.m. Thank you.